Colitis means inflammation in colon where digested food becomes poop. Inflammation in your colon can make your poop more urgent, painful, runny, or bloody. You can get temporary colitis from an infection. Some people have chronic colitis. Colon is the last leg of the journey your food takes through your digestive system. Inflammation in your colon can affect the way this journey ends, causing pain, diarrhea, and sometimes blood in poop. Inflammation is your body's response to infection or injury. It causes swelling and tenderness in your tissues. Pikes. Ulcerative colitis. A chronic condition causing ulcers and inflammation in the colon's lining. Its exact cause is unknown, but it's believed to involve a combination of genetic, immune, and environmental factors. Ischemic colitis. Caused by reduced blood flow to the colon, usually due to blood vessel blockages. Risk factors include age, cardiovascular diseases, and conditions affecting blood vessels. Microscopic colitis. Characterized by microscopic inflammation in the colon lining. The cause is unclear, but factors such as autoimmune reactions and medications may play a role. Infectious colitis. Caused by infections, often bacterial or parasitic. Contaminated food or water, poor hygiene, and exposure to infected individuals contribute to its occurrence. Chemical colitis. It results from exposure to certain chemicals or medications that irritate the colon lining. Causes. Infections. Bacterial, viral, or parasitic infections can lead to colitis. Examples include Clostridium difficile infection, which often occurs after antibiotic use, and infections from organisms like Salmonella, Shigella, or E. coli. Autoimmune reactions. Inflammatory bowel diseases such as Crohn's disease and ulcerative colitis are characterized by an abnormal immune response that leads to chronic inflammation in the gastrointestinal tract, including the colon. Inflammatory bowel diseases. Crohn's disease and ulcerative colitis are chronic conditions where the immune system mistakenly attacks the digestive system, causing inflammation. Ulcerative colitis specifically affects the colon and rectum. Ischemic colitis. Reduced blood flow to the colon, often due to blood vessel blockages, can lead to ischemic colitis. This may result from conditions like atherosclerosis or blood clots. Allergic reactions. In some cases, an allergic response to certain foods or substances can trigger inflammation in the colon, contributing to colitis. Microscopic colitis. This is a type of colitis where inflammation is visible only under a microscope. It includes collagenous colitis and lymphocytic colitis, and the exact cause is often unknown. Genetic factors. A family history of inflammatory bowel diseases may increase the risk of developing colitis, suggesting a genetic predisposition. Environmental factors. Exposure to certain environmental factors, such as smoking, may influence the risk of developing colitis. Stress and diet can also play a role in exacerbating symptoms. Medications. Some medications, like nonsteroidal anti-inflammatory drugs or certain antibiotics, may contribute to the development of colitis in some individuals. Sign and symptoms. Symptoms can vary depending on the specific type of colitis. Here are some common signs and symptoms. Abdominal pain. Individuals with colitis often experience discomfort or cramping in the abdominal area. The pain can range from mild to severe. Diarrhea. Persistent diarrhea is a common symptom. The stools may be loose, watery, or contain blood, depending on the severity and cause of colitis. Bloody stools. Inflammation in the colon can lead to bleeding, resulting in the passage of blood in the stool. The blood can be bright red or darker, resembling coffee grounds. Fatigue. Chronic inflammation and frequent bowel movements can contribute to fatigue and weakness in individuals with colitis. Weight loss. Severe colitis can lead to a decreased appetite, nutrient malabsorption, and weight loss over time. Fever. In some cases, colitis may cause fever, indicating an immune response to the inflammation. Urgency and frequency. There might be a frequent and urgent need to have a bowel movement, which can disrupt daily activities. Complications. Colitis can lead to various complications, depending on its severity and underlying cause. Some common complications include dehydration. Persistent diarrhea can result in fluid and electrolyte imbalance leading to dehydration. Malnutrition. Chronic inflammation may impair the absorption of nutrients, potentially leading to malnutrition. Toxic megacolon. This rare but serious complication involves severe inflammation and dilation of the colon, which can be life-threatening if not promptly addressed. Perforation. In severe cases, the inflammation can weaken the walls of the colon, leading to perforation and the release of intestinal contents into the abdominal cavity, causing peritonitis. Colon strictures. Chronic inflammation may cause scarring and narrowing of the colon, resulting in strictures that can obstruct the passage of stool. Increased risk of colorectal cancer. Individuals with long-standing inflammatory bowel diseases, such as ulcerative colitis, have an increased risk of developing colorectal cancer over time. Treatment. The treatment of colitis depends on the underlying cause and the severity of the condition. Here are general approaches and interventions commonly used. Medications. Anti-inflammatory drugs. Corticosteroids may be prescribed to reduce inflammation during flare-ups. Immunosuppressants. Drugs like azathioprine or methotrexate can help modulate the immune system to reduce inflammation. Antidiarrheal medications. In some cases, medications to control diarrhea may be prescribed. Antibiotics. Antibiotics may be prescribed if there is an infection contributing to colitis. Nutritional therapy. In some cases, a special liquid diet or nutritional supplements may be recommended to give the colon a chance to heal. Lifestyle changes. Diet modification. Adjusting the diet to identify and avoid trigger foods or using special diets like a low-residue diet during flare-ups. Hydration. Adequate fluid intake to prevent dehydration, especially during episodes of diarrhea. Stress management. Stress reduction techniques may help manage symptoms. Surgery. In cases where medications are ineffective or complications arise, surgery may be considered. This can involve partial or total removal of the colon,